Hello everyone, welcome to our live session today. I will be going over a quick startup presentation to welcome everyone and introduce you to our program and the opportunities you have at Pre-Health Shadowing. Pre-Health Shadowing is a student-led, minority-led, women-led nonprofit dedicated to helping prospective healthcare professionals gain access to educational resources no matter their demographic, status, abilities, or location. My name is Muntaha, and I am the editor-in-chief here at Pre-Health Shadowing. Thank you all for attending today, and let's get started. So just a little PSA, let's go back. We do have closed captioning for all of our sessions to accommodate all students. So this setting is available on the bottom of your screen, and if you need assistance enabling the transcript, please direct message myself or one of our team members. We are always looking for more ways to be inclusive and ensure our sessions are accessible to everyone. So if you have any recommendations, please email us at info@prehealthshadowing.com. So since this is an international program, we want to know, where are you Zooming from today? Drop it in the chat and write where you're Zooming from. We usually have students from across the country and the world. Everyone's saying Florida and Boston, that's cool. All right. So if you want to stay in the loop, follow us on our social media. We are active on Instagram or TikTok, and you can sign up for our email list on our website to never miss a shadowing session. We have some wonderful opportunities for you all as benefits of being part of the program. We have partnered with Kaplan to get our students a 10% discount code that can be used on all Kaplan products, as well as free resources such as study guides to help prepare you for standardized tests like the MCAT, NCLEX, or PCAT. If you fill out our short survey in the chat, we will get signed up for these deals for free. We would also like to draw your attention to another amazing program, which is Neolith. Neolith is an online mental health platform for students. College and young adulthood is really stressful, even in non-pandemic times. So for pre-health professionals especially, we know that the path is not easy. That's why we have partnered with Neolith to spread the word and offer free access to their mental health services if you use the link in the chat or enter the code PREHEALTH when signing up. Next, let's bring our attention to Mask for Mask, which is an amazing women-led organization that donates 4 masks for every 4 masks sold. These go to people in need during the COVID-19 pandemic, so those in the homeless community, healthcare workers without proper PPE, and others who are struggling to stay safe. With our discount code for PHS15, you can get 15% off your order. If you buy through this method, Pre-health shadowing will also get 10% of the proceeds, which is amazing because you will be giving masks to people in need, and we are a nonprofit that does rely on our community. If you want to play a bigger role part in Pre-HS, we would love for you to join our network of student volunteers and team members. You can apply to be part of our administrative team, lead students in various projects and initiatives with professional outreach, grant writing, and more. We understand that as a pre-health student, you may not have the time, so we also offer the opportunity to volunteer asynchronously with tasks that can be done on your own time. We would love to have you be part of our program and contribute to your own unique perspectives and experiences. If you are a high school student and want to get involved, we have started a program called HTP, which stands for High School Training for PHS, which allows you to connect with college pre-health programs and get involved in fundraising for PHS. And you can also organize resources for other high school students who are interested in health and medicine. We want to recognize the hard work of all of our students in the program. So if you are interested in getting published, you can submit articles, essays, reflections, and research papers or reviews of our own sessions and through our website. So these submissions will be reviewed by the editor-in-chief, which is myself, and you will have your work displayed on our website. This will look great on CVs, applications, resumes, etc. So please take advantage of this and write if you would like. Part of our mission at PHS is to promote diversity. In order to do this, we have launched an initiative to have monthly panels to celebrate different demographics in the field of medicine. Some of these upcoming events include a series on patient experiences, a COVID-19 roundtable, and international student forum. If you have a mentor, professor, or professional that has inspired you and you think they could contribute to these conversations, please nominate them today using the link in the chat. If we can humbly ask that you donate to our program, please do. As you know, pre-health shadowing is completely student-run. We are working around the clock to keep this free and accessible to everyone. Unfortunately, Zoom and our website are not free, so any contribution you can give would be greatly appreciated. If you are not financially able, we request you send this link to someone you think so we can continue to support those who cannot afford the same opportunities. Throughout the session today, we encourage you to drop any questions you have for the speaker in the chat. Our team members will be compiling them at the end of the session so we can ask our professional. Make sure to take good notes as our professional is going over their presentation, as there will be the chance to take a post-shadowing assessment to verify your virtual shadowing hours. More information will be available on this at the end of the session, so stay tuned. Lastly, if we can, please turn your cameras on. This is by no means an obligation, but because we are socially distanced, we would like to feel a little closer with your cameras on. I appreciate you for listening. So now I'd like to welcome our professional, who is a nurse. Thank you so much for joining us today, and you may share your screen whenever you're ready.
All right, awesome. Glad to be here. Am I too loud? Nah, I think I'm good. All right, let's share my screen. So hello, everyone from all over. I'm glad to be here, honored to be here. My name is Eugene Brown. I am a registered nurse and a family nurse practitioner. And so the pre-health shadowing today is going to be about nursing. Next slide. So disclaimer, got to put disclaimers in, right? So opinions and points of view expressed in this presentation represent the presenter only, me, and does not represent official position of any other organization mentioned. I am mentioning that I do have a financial relationship with Western University of Health Science because I work there. So what is nursing, right? You see it on TV, you see, especially during the pandemic, what is nursing? So no one can decide, especially the specific definition, but a lot of us in nursing can agree on that it's both an art and a science. Now, what does that mean? The art part of nursing, that's that caring, humanistic part, treating individuals like they matter with human dignity and giving them respect in sometimes the hardest and lowest points in their life. Part of that art is also intuition. So what is that? You know, understanding something that doesn't have a conscious reasoning, because sometimes it may be unconscious or subconscious, sorry. And then advocacy. Nurses are super big on advocating for our patients and speaking up and supporting them to make choices, health choices for themselves. The other side of nursing is the science portion. So there is the critical thinking. So that is with logic and reason, and then putting that into application into a clinical setting, which is clinical reasoning. And how do we get that logic and reasoning? We look at the research. What is evidence-based research so that we can do interventions that will produce high quality care for our patients. And so that's part of evidence-based practice. So what do we do? So this is from the American Nurses Association, which writes the Nurses Code of Ethics. And so these are the definitions of what we do. There are 3 categories. There is the licensed vocational nurse, which is an LVN, also known as a licensed practical nurse. There is the registered nurse, and then there's the advanced practice registered nurse. And so we always talk about in nursing what our scope of practice. So, and I'll talk about education and licenses. So this is saying, what are we allowed to do with the license we have or obtain? So we'll start with LVN. So that is a person that's usually under the supervision of a registered nurse, an advanced practice registered nurse, APRN, or MD or DO, a doctorate of osteopathic medicine. And so what are they allowed to do? They're allowed to do check vital signs. So what is that? Checking oxygen levels, heart rate, blood pressure, assess health status. How is the patient doing when they come in? What system in their body is having the problem or concern that the patient comes in for? Perform basic nursing functions, and that kind of goes with ensuring the patient's comfortable, well fed, and hydrated. So basic nursing functions, cleaning the patient, feeding the patient, making sure the patient is safe, the surroundings are safe. And then in some settings, LVNs can administer medication. Typically, that'll be oral medication. And LVNs are seen in various settings, but I've noticed that they're more in nursing homes with the elderly. Then we go to the registered nurse, and that's the one that you'll see in the healthcare setting, in the hospital setting more. And so that works in collaboration with a healthcare team. So we have doctors, occupational therapy, social work. And so we work within this team to help the patient, right? So we do physical exams, and then health history. So why did they come in? How long has it been happening? Have you had this before? So inquiring about their health so that we can get a better picture of what's going on with the patient. A big thing that nurses are a part of is health promotion and education. We are constantly educating our patients. Why? Because we want them to be successful in being a part of that healthcare team and being self-sufficient when they go home, right? If we don't provide them the correct education, they're going to come back into the hospital. We want to provide them the correct education so that they can live out their lives at home. And health promotion, so that's a big part of prevention. So especially with COVID-19, a lot of public health nurses doing a lot of vaccine clinics for COVID. We do administer medication, whether IV, so through the vein, or orally medication, and then other personalized interventions. And I say other personalized interventions because that's part of that art of nursing, right? No one tells you that, or if I have patients that are on their menstrual cycle, I say, hey, would you like a heat pack? Because I know some of them, they say that it helps. You know, that's not something that is guided by research for me to do. That's something that's that personalized care for that patient. Then we have the advanced practice nurses. And so depending on the classification listed there, and depending on the state, you can either practice independently or under the supervision of an MD or a DO. So we have a nurse practitioner, which is prescribes medication, diagnoses, and treats minor illnesses and injuries. Because I'm also a nurse practitioner, I know a little more about that. So in California, we do have to be under the supervision of an MD or a DO, where in other states, I forgot where, they can have their own practice. Then we have the certified nurse midwife, which deals with gynecological and low-risk obstetrical issues. So women's health is very important there. We have the clinical nurse specialist, and that is someone that specializes in a variety of physical and mental health problems. And I said find the gap because they're usually always searching for what we're doing, how can we make it better, right? How can we improve stuff so that we have better patient outcomes, so our patients are healthier, our populations are healthier. They're really good at that. Then we have our CRNA, also known as our certified registered nurse anesthetist, and they are able to administer anesthesia. So path to nursing education. So there are multiple paths to become a nurse, and any one of these may be for you. So like we described earlier, your licensed practical nurse, that takes 18 to 24 months. You don't get a degree, but is the practicing nurse license. Then we have an associate's degree in nursing, also known as an ADN nurse. And that programs typically take 2 to 3 years, and that's usually offered at a community college setting. We have the Bachelor's of Science in Nursing, also known as the BSN, and that's typically 4 years, usually at a 4-year university or private college. And then we have one that's got more tracked and being more noticed in nursing, and that is the entry-level master's program in nursing. So that's usually 1 to 2 years. And so what happens is that nursing isn't always someone's first career in life. Maybe they were a paralegal or a pastor, you never know. There's all of them, right? So they have a bachelor's in another field, but they want to become hope you're all right, whoever that was. A bachelor's in another field, and then they want to become a nurse. So then they do a master's, get a master's degree and become a nurse that way. So you can actually enter nursing in any one of these programs. You know, you don't have to start as an LVN, then go to ADN, then go to BSN, and then go forth. You can start at an associate, you can start at a bachelor's, you can start at an entry-level master's. Okay. And so paths to nursing. So after you get the education, now you have to take a test that says, hey, you are safe to practice, right? So you got to pass the test. And the test is called the NCLEX. It's the National Licensure Certification Exam. And once you pass that, yeah, you pass, okay, you have to send that to the Board of Registered Nursing, who issues the license. So LVN, they'll issue that, they'll issue the RN license. I put advanced practice a registered nurse there as well, because in order to become an advanced practice registered nurse, you also have to have initially your registered nurse license. Okay. And I think I put it. So advanced practice registered nurses, you do have to hold a master's degree in order to get or apply for that. So here are just a little bit of the ton of nursing career specialties. And so there is the med-surgical telemetry. So you're dealing with people that are sick, but not direly sick. So medical could be COVID. Patient with COVID and they're having respiratory problems. Surgical could be that they were in an accident and they broke something and they just came from surgery and they're stable. So they're on your floor, just recovering. And then telemetry says, is where they're like, hey, they have some heart issue, cardiac issue, and we need to monitor them a little more closely. So that's that. That's usually adults. And then we have pediatrics. So working with children. We have psychiatric mental health. We have labor and delivery, working with birthing. We have geriatrics, so the older population. And then we have the ICU, also known as intensive care unit. So they're admitted. They have a lot of things going on. They're really, really sick. So we need to monitor them very frequently. That's where the ICU comes in. Then we have emergency room, nurse specialty. Some hospitals are designated as trauma centers. So you can be a trauma ER nurse, flight or transport nurse, where you are transporting or helping stabilize them until they get to the hospital. We have an OR nurse. We have wound care. So someone that just focuses on wounds all day. If that's your thing, there's a specialty for it. Then we have dialysis. So someone that their kidneys aren't working right at all. So managing the patient and what's going on with the patient, as well as the big machine that helps filter out the blood. There's a specialty for that. There's a specialty for public health, school nurse, forensics, if that's what you want to get into. If you want to work more in medical cases, so legal nurse consultant, maybe there for you. Aesthetics and cosmetics, so Botox and derma filler. You really need to know your facial anatomy. You need to know all the arteries because that's what you're working with, and what type of Botox and derma filler that you're using. Very important there. Dermatology, working with skin. Infection control always usually has a nurse in the hospital on that team. Case management, nurse educator, informatics, if you like technology and improving the systems we use to document and chart and relay information, that may be for you. And then, like we said, the specialties, the nurse anesthetist, nurse midwife, nurse practitioner, clinical nurse specialist. With nurse practitioner, you can have a specialty depending on your education. So family nurse practitioner, pediatric nurse practitioner, psychiatric nurse practitioner, and so forth. If I'm talking too fast, let me know. Okay, so paths to nursing. So you have your degrees and license. So this was my path. So right out of high school, I went and applied to colleges. I got accepted to a couple, and I really chose the one that gave me the most financial support. Because being the oldest out of four and the first one to actually go for a healthcare profession, I originally was a double major in bio pre-med to focus in doing orthodontics. And I had a music scholarship. And so I was also double majored as a music vocal performance major. And what really took a turn was when one of my family members was in the hospital. And I remember looking and seeing the interactions between my family and the nurses and the family and the healthcare providers. And I really said, you know what, I can definitely see myself for the rest of my life doing what the nurses do, how they were so caring and interactive with my family. So then I switched to nursing. Got into the program. I went to California Baptist University, and that's in Riverside, California. I graduated in December 2014, then took my NCLEX, passed, and became a California registered nurse since 2015. Then I went back to school and got a Master of Science in Nursing because I just love school so much. No, I know that the more education I have as a nurse, the better patient outcomes we have, and the more knowledge and resources that I'm able to give and support the people I serve. So I got a Master's of Science in Nursing in 2019 from California Baptist University. And then I took my national certification to be a family nurse practitioner, got that, and then applied and got my California license for that since 2019. And then I said, you know what, let's go all the way, right? So I got a doctorate, or getting a doctorate of nursing practice. And so you can either get a DNP, which is what I'm going for, or you can get a PhD in nursing. These are both research degrees. PhD focuses on new knowledge, right, and bringing it to the profession. Whereas I chose the DNP because it aligns better for me with the family nurse practitioner, because it is translational research. I'm able to take what I'm on and then applying it into the practice that I have. And so that's in progress, and that's at Western University of Health Sciences. So my nursing career. So I started off, I applied to a couple places, and I chose Corona Regional Medical Center in Corona, and that was in 2015 when I got my license. So I was a new baby, new grad. I did get into their residency program. And so some hospitals, if you don't know, have residency programs that say, hey, I know you're new as a nurse. Let me support you. Sometimes it's 3 months, sometimes it's 6 months. Let me support you through your first year of nursing, right? And so typically it may be once a month or twice a month where you're 3 days working. One of those days is a whole education day. to making you a better nurse and supporting you. And so I did that for a year. I graduated and completed my residency program. And I started off in adult med-surg telemetry. And then I went on to cross-train because they needed more nurses. And I said, sure, why not? To progressive care in pediatrics. And that's where I was like, wow, I love working with children. And so then I took a leap and applied to Loma Linda Children's Medical Center in 2017 and got hired on as an acute care pediatrics nurse. And the amazing thing about that is that it's 3 units in one, so it's a really big unit. And because we're such a big unit, we do help out the other units when they don't have enough nurses, maybe for the night, because I worked night shift. And so you need to know a little bit about a lot, right? So my float experience happens with, and each part of pediatrics, they focus on something different. You focus on different assessments, different labs. So what I saw more in adolescents, I saw more psychiatric or behavioral disorders. I did see more eating disorders in that population. When it came to hematology, I can't speak, hematology and oncology, so that's blood and cancer. So knowing what type of cancer, where it's at, how far it's progressed, what are their blood labs look like, when's their next chemo treatment, all these things I need to know for that unit. And so acute care pediatrics is like the adult med-surg. It's they're sick, but they're stable. If they need a little more monitoring and they're a little more sick, we transfer them to step down. Now, if they're even sicker than that and really need to monitor, maybe one nurse to one patient or one nurse to 2 patients, you will either go to neonatal, pediatric, or cardiac ICU. Cardiac ICU, that is when typically a patient has a heart defect that's really causing a lot of problems and why they're in the hospital. Neonatal is when they're just born and they may be even like a hand size, that small, and they need help a lot of times with like feeding, breathing, and we have to be very on the mark on how many calories that they get so that they're progressing in their weight. And then all of their kids that are super, super sick go to pediatric ICU. And then because I was doing a lot of clinical precepting for new grad nursing students at Loma Linda, I started liking the teaching aspect. And so I started adjunct clinical instructor pediatrics over the summer in 2019 at Western University of Health Science. They needed pediatric clinical instructors, so I said, sure, why not? And I liked it. And then let's see, a year later, I applied and got a full-time assistant professor position as their new pediatric nursing expert. So here are some of the courses I've taught so far: care coordination and chronic disease management, pathophysiology. Practicums are the clinical experiences. So they may be in the hospital or virtual because of COVID. So, or simulation based. So leadership fundamentals, med-surg 1. And then the ones I'm teaching this semester, yeah, we're in semesters, is improvement science for quality and safety and clinical implementation 1 and 2. All of these, Western U is really big about co-teaching. So I do have a mentor because I am new as faculty, and we work together to teach our students. And okay, good on time. So part of that in academia, you do have to be a part of committees. It's required. In the hospital setting, I was part of a couple of different committees. At Corona Regional, I did patient safety handling. And at Loma Linda, I was part of the admit, discharge, transfer pilot committee. And so Western University of Health Science is a graduate-only healthcare school. So we have osteopathic medicine, we have veterinary medicine, we have PA, we have nursing. So those are the colleges, and then we have the university as a whole. So I am a part of the College of Graduate Nursing Committee's curriculum. So looking at what we're teaching, how we're teaching it, how we can teach it better. Maybe we need to rearrange some of the courses. And that's usually a collective effort with faculty and staff, recruitment, admission, and social media. And then diversity, equity, and inclusion, which is a newer one. Excited about learning a lot. And then the university as a whole, which has comprised of faculty members, deans from other colleges, dental medicine, and so forth. We come together, and it's a, for the group that I'm in, is recruitment, admission, and hiring, specifically for diversity, equity, anti-racism, and inclusion in healthcare. And then a professional organization that I'm a part of a couple, but I'm more actively involved in Sigma Theta Tau International, Honor Society of Nursing. So this is the largest and only Honor Society of Nursing internationally. So most colleges of nursing will be associated with a chapter, and I am the president for the KaiMu chapter in California. And so what we do is it's connecting and empowering nurse leaders and nurses, especially new grads, because that's a lot of what I work with, scholarship, leadership, and service opportunities in the nursing profession. So the day in the life, right? So there are my nursing duties versus my nursing professor duties. It's a little different, right? So my patients typically would be, because I worked as a pediatric nurse, children. So birth, I remember I've had a patient that was like 4 hours old, and I was like, oh, okay, all the way up to 21. And then typically you'll have 12-hour shift, 3 days a week. If you want to work more, you do that. But 12 hours knock me out. I'm like sleeping for the next 3 days, and then I'm back to work again. And so, like I said, you have your staff meetings as a nurse and then committee meetings as a nursing professor. So staff meetings really brings together night shift, day shift on a unit. How are we doing? How can we improve? Here's some education or skill sets that we need to teach you so that you can do your job better for our patients. And then on the other side, we have nursing professors. So instead of children, I work with adults, my students are my patients, the community I serve. And it changes every week. So the committee meetings that we have, they're not every day, maybe once every 1 month. And then depending if I have a clinical, depending on what day the clinical is, and that's 12-hour shift. And then what classes I'm teaching, they're not taught every week sometimes. And those are usually 3-hour blocks of teaching straight. Yeah. So, and then I put the nursing process, because no matter what part of nursing that you're a part of, you always use the critical thinking algorithm that we use. So ADPI, so that's assessment, what's the situation or what's going on with the patient, diagnosis. Nursing diagnosis are a little bit different than medical diagnosis. And then planning. So what's our plan? Our intervention, what's our nursing intervention within our scope of practice? And evaluation. We need to make sure that whatever we did to intervene to help this patient get better, that it worked. If it didn't work, we need to try something else. Okay. Sorry. I burped, I'm sorry. So as a pediatric nurse on acute care pediatrics, we did have a designated seizure management unit. So I worked with a lot of seizures. And so seizures are bursts of uncontrolled electrical activity in the brain, right? And it causes either a change in behavior, muscle tone, or physical movement. And so if a patient's having seizure-like activity, right? And they're being monitored. So we make sure the button's pressed so we can record the electrical waves for the physician team and healthcare team in general. I need to know when it started, what the movements look like, document that, make sure if the family's there, reassuring the family, hey, this looks like a seizure-like activity. Going from there, making sure they're safe, right? Safety is the number one thing we do in nursing, making sure that their head's not hitting something, making sure they have a pillow underneath, making sure the headboards of the bed are padded, making sure that covers are off so that we can see that if there's covers on, we may not see that they're twitching in their leg. And that could be important because every little detail, and we describe every little detail, every twitch, every pause, and how long that is, tells the doctor something and where it's going on in the brain. And so then usually the order is to get Ativan, and if it's greater than, what was it? It's greater than 5 minutes or 2 seizures in less than 30, yes, in less than 30, then you give Ativan. And so typically it's shown that if a seizure lasts longer than 5 minutes, it's not going to stop. So you do need to do an intervention, right? So then you give the Ativan through the IV, and you need to make sure it works or it stops it. If not, then you go notify the doctor, absolutely notify the team, and then what next steps to go from there. Whereas a nursing professor, how I use the nursing process, a little different, right? So it may be that we're assessing what we taught for the student. So it may be a quiz, right? We lectured, we gave something on respiratory, lecture on respiratory in nursing, and they take a test. And let's say that most of the students didn't do well on a certain concept that they need to know. So it's either, and so then I will go back, and what's my plan? I'll go back to my slides and I'll match that with what the book says, and then I'll match that with what the quiz said, and said, was there some miscommunication? What did we, how can we do it better? Did I need to give a visual aid for people that are more visual? Did I need to explain it a different way? And then reiterate that in the next class. And then in office hours, if a student's really not getting this concept, and then going over in the study guide, and then retasking it for the midterm or the final to say like, hey, okay, we did some type of intervention so that you can understand this concept in respiratory. Did that work? And that's our evaluation. If it didn't work, okay, we need to try something else. Talking with students, how could we have done it better? And always trying to improve. That's the one thing about nurses. We're doing the best we can in evidence-based research, but evidence and research is always changing. And so you always have to be reading and learning new things constantly to better serve the communities that we serve. Yeah. So a little bit about Western U's admission process, if you're interested, right? Okay, so you do have to have prerequisites before applying. So nutrition, social science, communication, statistics, microbiology with a lab, human anatomy with a lab, human physiology with a lab, and psychology. Western U's admission process, because we are a graduate university, you do have to have a bachelor's degree in something. I know some people that entered entry-level masters, they had public relations before, or they did health sciences as a bachelor's, or whichever. Okay. You do need 2 references to complete it by a supervisor, where you work, or faculty. Non-related, there is a minimum GPA of 3.0 for overall, and then whatever it says last 60 semester or 90 quarter units, whatever your last couple of classes that you took, how well did you do? These are basic requirements, but we do see the application as a whole, right? This is not the only thing that can qualify someone to be a good nurse or be a good doctor or be a good occupational therapist, right? So there are 2 parts. We have the people that apply, right? And so faculty, staff, and part of the recruitment admission, we review the applications. And so it's just the application, see what it is. We put it in the algorithm that's already set for us. And then the algorithm and the admission committee selects 200 applicants for interview. And so then the people that get interviews, it's a blind interview, which I really like about that, is that whoever did your application, your initial application, won't be the one that interviews you. So it's a fresh start, seeing you from a different spotlight, right? We don't see what your application said. We don't see what the other person wrote. All we know is that there's an interviewee in front of us, and we're just asking you questions, right? Getting to know you. Typically it'd be face-to-face, but since this year COVID, we did virtual. And then from there, we do our remarks and yada, yada, yada. And then the admission committee selects 60 to 70 applicants into the fall cohort or class every fall. And then there is an alternative list, because some people, you know, they get offers at other places, totally fine. You know, and we do have alternative lists, which is also known as the wait list of qualified applicants as well. So, advice to future healthcare professionals. And I said healthcare professionals because, and this is my own viewpoint, not everyone's supposed to be a nurse. Not everyone's supposed to be a doctor. Not everyone's supposed to be an occupational therapist. We all have something to contribute to healthcare. And if you want to do healthcare, there's absolutely a place for you. Nursing may or may not be it, right? We need more healthcare professionals in all of the different professions. So I kind of did little pointers that will help you in all of them, and any path you choose in healthcare to helping people. So healthy coping mechanisms. Oh boy, especially with COVID and stress with everyone. You need to know how you cope with stress, because any program, nursing program, med program, OT, speech pathology, any program in healthcare is not easy. And you most likely, a lot of times, will cry and be stressed. So you need to know how to have healthy coping mechanisms, or start them now, and do self-care. Big about self-care and mental health, right? And then effective communication. The more you practice with different types of people from different backgrounds, different ages, you're going to be more comfortable with communicating in a variety of settings, which is so useful in any healthcare profession. And this is with any job: time management and prioritization, asking questions. The students or people that I've precepted that don't ask questions worry me more, right? I'd rather have someone ask a question and then me be able to correct or support or validate what they were thinking, rather than someone that may not, or too scared to ask a question and then they do something wrong, right? Seeking a mentor. I had mentors going through pre-nursing all the way through nursing, and they've changed over the years. Even now I have mentors, right? And then I am a mentor for a couple of nurses that I've known for quite some time. And I just find that enjoyable, and that will actually help you. I think it's that like moral social support, be like, you can do it. Seeking a mentor is very, I think, beneficial. And then if you can, volunteer, internships, healthcare experience. It doesn't absolutely have to be designated to nursing, because every part of the healthcare system is useful. And I'll give the example of environmental health science. So the people that clean the rooms after a patient has been discharged, whichever. Every person matters, right? And so if you start there, you go all over the hospital. You know how important it is to know exactly where you need to go in a critical time frame? Very. Do you know that they know a lot about infection control, right? Because they're cleaning, they knowing the certain type of products. And so that can actually probably help a person once they become a nurse because they already know the background as well as parts of that healthcare system. Or central supply, knowing what is available in their central supply of the hospital and what part of the building it is. That's so important. So yeah, or doctor's office, knowing how to paperwork, right? Getting any type of healthcare related experience will benefit you in some way. Absolutely. And that's all I have for you guys.
Thank you for
Did I
that
talk?
awesome presentation. We're just going to go ahead and have a look around the room with our polling questions. So let's do if anyone is interested in nursing. I'll give a few seconds for everyone to be able to answer it.
Everyone's like, after my presentation, nope, not for me. I'm not the one.
Actually, the answer for the majority is yes. So
Oh, that's exciting.
probably because of you. Probably because of you. Thank you for your amazing presentation. We'll go ahead with our Q&A portion of the live session. So Trung asks, how can you differentiate between a nurse practitioner and a physician's assistant, since they have similar roles?
Excellent question. Hold on, let me just text this person direct message back and then I'll answer that. Okay, so the difference, we do have a lot of similarities. We do, absolutely. Because once I became a nurse and got my bachelor's in nursing, I could have chosen to take the physician assistant path in getting my master's. I liked the nursing mindset and frame because I'm already a nurse, and so I chose family nurse practitioner. The difference is that because within the name of PA, physician assistant, you will always be under an MD or a DO. Whereas a nurse practitioner, in some states, you can have your own practice. So that is the difference. PA will always be under the supervision of an MD or a DO.
All right, thank you for that answer. So Bookthee, a student, asks, I've heard the saying, nurses eat their young. Did you feel overwhelmed as a new nurse when you graduated, and were the more experienced nurses very tough on you?
So I would say no. There are places that have nurses that eat their young. Unfortunately, that doesn't create a culture of safety and support for new grads, which I don't approve of. I was fortunate enough to have a lot of older nurses support me in my first year. In my first year of nursing, I'm that A-type personality. I wanted to be good right away, and then I was mad because I wasn't. And so I think my first year and a half, I worked as much as I could. 6-7 days a week, worked. Why? Until I got used to being a nurse, until I got used to certain disease processes and educating patients on them and knowing where everything is. And so, where it depends on where you get your job and where you work. If the culture is toxic, you can leave.
Definitely.
You can go to a place where the culture is supporting you, right? You're a new grad. There's a lot of things that you still have to learn. No matter how much we teach you in school, there's still so much you have to learn.
Mm-hmm.
So you need a place that will support you in that.
Yeah, thank you for that advice.
Mm-hmm.
Ada asks, what challenges have you faced as a nurse, and how did you manage to overcome them?
That's a good question. Okay. One of the biggest challenges, especially because I'm that A type, I want to know everything. And I don't. And the more I learn and the more educated I become, the more I learn that I don't know a lot. And that's okay. But you do need to know a little bit about a lot and at least the basics, right? I need to be able to keep a patient safe. That's the basis of everything we do. When in doubt, if you don't know everything, look it up, read on it, right? So, and letting that go and being okay with not knowing everything, because there's no way. That's why there's specialties. That's why even in medicine and PA, there are specialties, and there's a reason why, because not everyone's going to know everything. So,
yeah, it can be really tough on students, especially those who've gotten good grades and have always been taught that you should know everything. So Lizeth asks a question pertaining to that, actually. She asks, how do you manage working such long hour shifts? Like you mentioned, your 12-hour shifts, which are ridiculous. And how do you make time for your personal life and self-care despite having to work so long?
what personal? I'm just kidding.
God.
Repeat the question one more time. I'm so sorry.
So Lizeth is asking, how do you manage your personal or like self-care habits, even when you're working such long shifts, like you mentioned, your 12-hour shifts?
Okay, so 12-hour shifts are actually not that long. You actually get used to it. Anything less than that, you're like, oh, okay, well, that was short. Yeah, no, there's so much to do. The time goes by. Let me just say, yeah, you typically get used to it. And then how do I do self-care? For me, it's exercise, either jogging or weightlifting, because for me, it's an integrity thing. Like I can't tell my patients to, or educate my patients to eat healthy and live right if I'm not doing it myself. Lead by example. And get exercise where I can, try to meal prep as much as I can, but I will eat some tacos every now and then. Absolutely. Those are my favorite. And all about that balance, right? Sometimes, if you're really stressed out, knowing what de-stresses you. Sometimes it's music for me. Sometimes it's reading a book, talking with friends over the phone, or just walking a mile.
Yeah.
Yes.
Thank you for that. Thank you for sharing about your those things that you do to help you. So Ashley asks, what is the best and hardest part with working with children?
I think it's the mindset. Some people are like, oh, working with children, I could never. I couldn't. For me, I see it as I have the education and the ability to help them when they need it. And I'm able to do something about their recovery or healing process. So you get used to all the crying. There's a lot of kids. And what was the question again? I want to make sure I answered it correctly.
You did kind of answer it. She
Okay.
asks, what's the best and hardest part with working with children?
The best babies. I love working with babies. If I have like one that I'm just like feeding and holding around, oh, it makes my day. And that's when I knew that like pediatrics was for me, because I woke up, especially just like going to work, and I just enjoyed working. Like it wasn't even work because I was working with these little kids, right? It was just like fun time. I just, they're sick, but for me, it was a joy to be there. And so that's when you're like, hey, this is like where I'm supposed to be.
Yeah, that must be so refreshing to be with those aspects of your work that you love. Julianne asks, how can I stick out as a transfer student from a community college to a university, especially when I am a pre-nursing student?
How can you stick out? It's a good question. Ask questions. Ask questions. No, I'm just kidding. It depends on what your background is. It depends on where you're going. I know that like when when I first became a nurse and like applying for jobs, like I had no healthcare experience prior. But I worked in retail for about 6-7 years. And so I use those examples, working with high volumes of people, especially during holidays. People get aggressive about pants and jeans.
Black Friday.
And having the best customer service and working with children, adults, all different type of backgrounds, and using that as a leeway into practical application of my skills into nursing.
Great. So why would you recommend someone to be a nurse? This is coming from Megan, who is asking if she should be a nurse because she has so many like different pathways in mind.
Don't do it. Don't. No, I'm just kidding. I'm totally kidding. It's rewarding. I would say it's very rewarding. It's not going anywhere. Nursing will always be there. So, job security, it's good pay. And I honestly, if you like helping people, because that's a big part of it, is serving others. So if you like that, nursing may be for you.
Great. So Tenzin asks, do you think they will require a doctorate for APRNs anytime soon? Would you recommend getting a doctorate over a master's degree?
So I think it was in 2015 that they recommended that advanced practice RNs have a doctorate. It's not required yet. I'm getting a jump ahead of it. I'd rather just get it done now. To just have it done, because that's where nursing is going. Nursing is leaning towards higher education for entry into healthcare as a nurse. So it's your choice, master's or doctorate, but it will, it's looking like it's going towards getting a doctorate in nursing for advanced practice RNs.
Going along the same path of that question, Josie asks, how long do you have to have experience as a nurse before you can qualify as an APRN?
So depending on the school, a lot of them require at least 1 year of nursing, 1 to 2 years of nursing, or like 2,000 hours before going back. And I say that because I noticed that when I was in my master's program, the people that went straight into the APRN section with me that didn't have the experience already as a nurse, they were trying to learn how to be a nurse and learning how to be a family nurse practitioner, and the mindsets and the algorithms and how you think are completely different. And so I would say I pooled a lot of what I experienced and with my healthcare experience as a nurse into my family nurse practitioner education. So
I feel like one of the overall themes we see here is just having experience with people and with a lot of ages. It's really important. Along those lines, Samantha asks, do you recommend getting a CNA license or becoming some sort of caregiver for patients before starting nursing school, just to have an idea of what it's like?
Yeah, you definitely can. It's definitely possible. Getting your certified nursing assistant, that gets you into a healthcare organization to see if you really like it. I know some people got their CNA license and work as a CNA in hospitals, and some of them realized that like they liked the CNA portion, but they didn't really like nursing, and so they went other routes with pursuing healthcare. Then some people are like, you know what, that's exactly what I want to do. And so usually if you're a CNA, wherever you work, they usually will help you get to and support you in becoming a nurse. So.
Margaret is asking about the doctor and nurse relationship when you're dealing with patients. And she also wants some insight on how do you work as a team in healthcare.
Okay, so the doctor and nurse relationship. No, I'm just kidding. When in doubt, even if we do have disagreements, the main thing we can agree on and that I always focus on is safety. Because why are we here? We're here to give high quality care and safety to the patient. So that's something we can agree on. And if the patient is conscious, let them be a part of their care plan, right? The second part of that question was?
She wanted to talk about the team relationship within healthcare and the patient and the nurse's role in that.
Absolutely. So we're big on care coordination, making sure that they get what they need. So sometimes you have to contact social work or case management because maybe you have a patient that's a new diabetic and they don't have supplies at home to check their blood sugar, a glucose monitor, a strip, what is their insurance paying for that, all that stuff. You need to get the ball rolling and referrals for those things so that they can take care of their self, and then as well contact the diabetic educator, making sure they're educated on how to do the finger stick, when to check their blood sugar, what are carbs, what are sugars, how to manage the newly diagnosed diabetes at home. And then also educating and bringing in the family. Who's their caregiver? Who's going to be with them to help support them? What other resources in the community that they need, diabetic support or whichever, so that they can support them living their best as much as they can outside of the hospital.
Awesome, thank you. Josie is asking, what do you learn in a master's program? And since you mentioned that the doctorate degrees usually are research-based, is there some aspect of research in master's programs as well?
Good question. I'm like thinking. So masters built off of the bachelor, for me personally, built off the bachelor's and went more in depth with a lot of what I had to do. So especially because I did the family nurse practitioner, I did advanced pathophysiology, advanced pharmacology, and advanced physical assessment. Because now you're looking as a family nurse practitioner, not just, oh, they have a respiratory issue. Is this pneumonia? Is this asthma? You know, what are the different differentials? And then what am I going to need to care for them? What labs do I need to order? Who do I need to refer them to? Can I manage this in an outpatient setting? Do I need to send them to the hospital? What x-rays do I need to get done in a timely manner? What education do I need to get them? What do I need to prescribe them? What is the microorganism that's commonly found in this vicinity where I'm working that usually produces this type of pneumonia? So there's so much more that I've learned. And even as a bedside nurse, when I was going through this, I grew so much because I knew so much more from a higher level of thinking in managing my patients when I was a floor nurse, even with my master's education.
Awesome, thank you. So Millie is asking, would I be able to become a nurse practitioner going into a PA path? Or is there a path for nurse practitioners that people have to take?
So, able to become a nurse practitioner into a PA?
She is taking the PA path, and she wants to know, let's say she changes her mind and wants to be an NP, if she can still be an NP even though she's a PA path.
Is she in a PA program?
Yes.
That would be kind of difficult, but it's doable. You would have to get the entry level master's program and get your RN license first in order to become an NP. So you'd have to go through another master's.
Oh, okay.
Or entry level master's section and then do the whole thing all the way up to the DNP. They have a program that continues all the way into a DNP. So you can do a program like that as well.
Trung wants to know if you can share some tips to ace the TEAS or the NCLEX.
Say that one more time.
Trung wants to know if you can share some tips to ace the TEAS or the NCLEX exam.
Oh, the TEAS test. That's right. That's to get into a nursing program. Or the NCLEX. For the TEAS test, read the book. No, I'm just kidding. I would say it's basic knowledge for the TEAS test to see. It's usually a predictor of how well you're going to do in nursing school. That one, it's been so while. I haven't taken that in forever. There are review courses for TEAS as well as NCLEX. I took two different review courses for NCLEX before I took mine, and they both gave me something different. One focused on content and safety, and the other one taught me how to actually take the test, because there's a certain way to take the test. And those two together, I passed the first time. Same with the family nurse practitioner. I did do two different review courses that gave me a little bit of something different perspectives, because there were some disease processes in one review that I got more, and then in other disease processes and sections, I got better understanding. From there, is married those two together, studied both of them, and then I passed. So review courses do help me personally. They've helped me. So.
All right, Anthony is asking, how do nurses stay up to date on current research or just current medical knowledge when they're doing their job? Or is there an examination, or do they get like information from their work?
So a lot of that is with your staff meetings. That helps you be current on how to practice efficiently, as well as you do have to do continuing education credits. There's 30, and you, in order to renew your license every 2 years, you do have to do those 30 units of continuing education. If you're in schooling, like a master's or a doctorate, that counts as education credits, or you can actually take classes or go to seminars and symposiums to look at the latest research in your specialty. If it's pediatrics, you can go to a pediatric conference. If it's wound care, there are wound care seminars that you can go to be up to date with the latest products, as well as the current guidelines, because those change as well.
Awesome, thank you. Do you have any like personal learning techniques that you use? Do you listen to certain podcasts or read certain things?
I was the worst student. Okay, no, I'm just kidding. And I used to have like testing anxiety, and for me, I learned better writing it down, drawing a picture, and then trying to teach it to someone else. That has helped me with studying so much more than before. So, and then like resetting myself, doing some type of self-care activity to like reset my brain. As well as I learned that my brain works better during the night. And this is also why I became a night shift nurse, is that I was better at studying in the middle of the night, at midnight, at 1 a.m, than I was during the middle of the day. So knowing when your brain is the most awake and most active, for me, it's night shift. So that's usually the time when I do study.
I see. I think that works for a lot of people as well, just knowing your learning habits so you don't feel burnout.
Exactly.
And
if you're burned out, you need to do some self-care.
Yes. Is there a specific thing that brought you to your current location at your job?
Is there a certain thing?
Yeah, like why would you choose the place that you're working at now?
Why did I choose Western? I think it has to do a lot with I'm like a face-to-face people person, and
Mhm.
so I got a good feeling when I was like talking with the people that were interviewing me, and the philosophy of Western U of humanism and caring for people more than just a diagnosis.
Mhm.
And the difference that I've noticed at Western U is that they're always focusing on um, the students, right? If there's any problem or concern, how can we be more student focused? What's the student perspective? How can we make it a better experience for them? Because it's a journey, right? Education's a journey, and always keeping that in mind, especially during COVID, and family members, and we get that, we're human too, that things come up, but that's why I said effective communication, letting us know either when it happens or as soon as a problem occurs so that we can work with you, because once you're in the program, there's no point in failing you. We want you to succeed. If we accepted you into the program, we're like, hey, we want you to finish to become a nurse. We see that you have so much potential to be a great nurse, and we want to get you there. But you also have to communicate with us. So I think that answered the question. As you can tell, I
You
ramble a lot. So
Thank you. You answered it perfectly and gave a lot of detail, so thank you. I'm sure the student is satisfied. So that's the end of the Q&A. Thank you so much for such an informative and amazing presentation. A lot of these students here are trying to be nurses and are interested in it, so you've helped them a lot with answering their questions and your presentation, of course. So I'm going to go ahead and share my screen so we can start with our wrap-up presentation for the end of the session. All right. So I think we all learned a lot from our wonderful speaker, but considering the presentation and everything that they have said, we would like to encourage everyone to reflect on the session today. So what brought you to the session today? What are 3 major takeaways you've got either from the presentation or Q&A session? And what do you want to learn more about? We encourage all of our audience members to take notes and reflect on every session they attend with PHS, just so they have some documentation of their experiences and thoughts. So if you want to learn more about pre-held shadowing and making sure that you are getting your articles and reflections and reviews submitted, make sure that you get the link in the chat and submit any of your thoughts on today's sessions in the case that you did write a reflection. So if you want to learn more about pre-health shadowing and get involved in our program, we encourage you to visit our website. You can become an asynchronous volunteer just like me and everyone here to get certified hours through professional nominations, graphic design, social media promotion, and all sorts of things that we do here at PHS. We are also accepting team member applications if you want to take on a more active role in PHS to lead projects, initiatives, and collaborate with like-minded students like yourself. Once again, we are asking if you are able to donate, that you should, because we really have a lot on our hands with our website and Zoom. It costs a lot to keep our program running. So if you can afford it or you know someone who is able to, please recommend donating to our organization. Otherwise, we simply ask you to spread the word about pre-health shadowing to reach as many students as possible. So now for the part we've all been waiting for, earning a digital certificate for the virtual shadowing hours from the session today. Go onto our website and find our professionals course pages. Next, you can take our quick 10-question multiple choice quiz based on the content from the session today. You will have 30 minutes per attempt to earn a 70% or higher to get your 2 hours of virtual shadowing. We know that sometimes technology can be difficult, so for this reason, in case our website messes up We do allow 2 attempts for each student to take the assessment. If you run into any difficulties, please contact us at info@freehealthshadowing.com. To ensure that our website does not crash from a high influx of students, we recommend waiting 30 minutes to an hour after the session to take the quiz, which will be open indefinitely. Once you have passed, you can click the bottom course button at the bottom of the professionals page and download your certificate verifying your virtual shadowing hours for today's session. If you missed a part of the session or want to go back and view other sessions and earn more certificates on your own time, you can totally visit our YouTube page at Free Health Shadowing. You can go onto our YouTube page, watch the recorded sessions, and take the quizzes from our website. Be sure to follow us on our social media or subscribe to our email list for the latest updates on upcoming shadowing sessions and events that we are currently booked every weekday through June for virtual shadowing sessions with multiple health professionals from a variety of professions and specialties. So please be sure to join us on every weekday. So I hope to see you guys there on our next sessions. Thank you for joining us today, and please stick around if you have any questions. Myself and other team members will be happy to answer them. This shadowing session is officially over, and I invite you all to log off. Have a wonderful day, and thank you so much to our wonderful speaker.